Hello, everyone, and a very warm welcome to our second National Health and Care Analytics Conference and the second event in our series of online e-labs, professional registration for data and analytics professionals. I'm Rachel Caswell. I'm an analyst in the strategy unit, and I've been involved with the planning of HACA, which celebrates the outstanding work of health and care analysts, bringing together analysts, leaders, decision makers to showcase how analysts support high quality decisions. Last year's HACA was a huge success, and this year is going to be even better. With almost 180 abstracts, we've designed an amazing program with inspiring speakers, interactive workshops, posters too, all centered around our theme of exploring the what, how, and why of analytics. Now, before I hand over to our guest speakers today, please keep your mic muted during the session and please introduce yourselves in the chat box. So we would like to know who we've got in the room today. Use the chat box to ask questions as well. And of course, if you have any technical issues, you can let us know there about them as well. The session is being recorded and will be on our website in a couple of weeks or so. And please do tweet about today's session. And we would like to see magenta all over Twitter, all over LinkedIn. Let's go for it, see what we can do. So our today's speakers are Jane Johnston. Jane is Director of Member Services, Association of Professional Healthcare Analysts, otherwise known as ZAFA, and Emma Wright, who is the Director of Professional Development again with AFA. So I would very much like to hand over to my guest speakers today, Jane and Emma. Jane, I think you're starting.
No, actually Emma is.
Oops.
Right, so first slide, yes, this is me. So session overview for today, things we're going to cover, who we are, about the professional registration, the history of how we got to this place now, a route to how you get through to the professional registration, the process for getting there, which will be Emma that takes you through that bit, followed by an opportunity for some questions. And the outcomes you can expect from today: an understanding of AFA and the professional bodies that support this, an understanding of the route to the professional registration, the different levels of registration you can apply for. There are 5 different levels, and an understanding of the process to actually get there. So overview of AFA. AFA's been on the go probably about 12-13 years now. It started out in the southwest of England for a bunch of analysts who just thought there's nothing really out there to support the data and analytics professions in health care. There are so many member organisations for some of our colleagues, clinical, obviously, finance colleagues, and we just wanted something there to support the analytical profession, to be a voice, because there's no real way for us to voice our views on the things that happen. There's so much that happens in the NHS that is so dependent on data. Everything's about data-driven decision making, data-based evidence, all this kind of stuff, and there's nobody there really for our profession. So we created a community of professionals so we could start networking, sharing ideas, sharing best practice, and also have that body there to be able to be the voice to talk back to NHSE, to the department, and try and improve the lot and the support for the analytical profession. We do have a range of collaborative partnerships, working with NHSR, HSJ, we've had recently, the Regional Skills Development Network. We also have strategic partnerships with Analyst X. Maybe many of you, I expect, are members of Analyst X through the Futures platform. Digital health, and we've worked with a variety. You will also be aware, many of you, of the National Competency Framework that's just been released through NHSE. AFA was actually originally commissioned by NHSE to help support this. So we have been heavily involved in the National Competency Framework because it all ties in with supporting analysts, with supporting career progression and professional development. So next slide, the offer from AFA. One thing we do have unique to us is the professional registration. There is no other, there are, you could, you know, there's Computer Society and things like the British BCS, things like that, FedIP, but there's no professional registration that actually support specifically people working in data in health and care, data analytics in health and care. So to that end, we are actually quite unique. We want to frame this registration professionalisation of our profession, because, as I mentioned before, our counterparts have membership bodies and our counterparts have to be registered. And nobody requests that analysts be registered, yet they will make decisions on how to spend millions and billions of funding without requiring any kind of professionalisation. And it's just to really help support the organisations to know that their staff are professional, and to help the analysts themselves and, you know, have confidence in their abilities, and it gives them something clear to work towards. We have networking events and conferences. There's many branch meetings. We have branches all over the country who have regular meetings, and the content of those meetings is driven really by the members within those geographic areas. We do have membership in Scotland, Northern Ireland and Wales as well, and branch meetings there. But because everything's virtual now, actually, if you see something that interests you from a branch in another part of the country, you can always pop along. We have an AFA annual conference, and our annual conference this year is in collaboration with Digital Health at Olympia in October. 23rd and 24th of October, I believe. So, you know, it's free to AFA members as well. So get along to all the branch meetings, get along to the networking events and the conferences, and sign up for the annual conference in October. We also provide a mentoring and coaching program. So if you're new into analytics or new into analytics within health and care, and you just want some guidance, maybe on career progression, then we can link you up to a mentor. However, if you've been in the job for a long time and you have a lot to offer, then you can also join us as a mentor. So there's an opportunity there for mentors and mentees to take part in that programme. And also you have access to networks. The Chief Analytical Officer Network is a new network. If you are ahead of information, it's just another network that we can get some of the leads involved in trying to drive the profession. So membership, we do have organisational membership. That's actually becoming quite popular. If you are ahead of in our audience today, then maybe you can talk to us about getting a corporate membership. There is a discount for corporate membership, but the membership itself is actually really not very high. Starts at £37 a year. That's based on up to band 6, or if you are, say, public health or social care, or not on AFC banding, the equivalent salary, and then above band 6 it's £47 a year. Compared to what our finance colleagues and what our professional clinical colleagues have to pay, it's well, less than a cup of coffee a day. Next slide, please. Oh, it's over to you, Emma.
Thank you, Jane. So AFA is part of a family of professional organisations that sit within the Federation of Informatics Professionals, or FedIP. So professional registration is with the Federation of Informatics Professionals. So HACA is licensed from FedIP in order to award registration to our members. So if you think about it like an MOT, so your MOT certificate might be issued by your local mechanic or your local servicing team, but the certificate itself obviously comes from the Driver and Vehicle Standards Agency. So your professional registration will be awarded by AFA as the licensed organisation, but your certificate, your registration will be with FedIP. So you can see on the screen the other organisations that sit within FedIP itself, and that is right across the spectrum of informatics within health and care. There is a fee to join FedIP, so that's on top of any membership fees you might pay to your own membership organisation. You can only join FedIP if you're professionally registered, and in order to become professionally registered you have to join FedIP. So that annual fee essentially is for your registration. But it does also open up the FedIP offer. So as well as what AFA offers as a member, if you become professionally registered, you also then can take up all the membership offers from FedIP itself. So you get access to the FedIP hub, which is a really good resource. There's lots of resources on there. There's places to log your CPD. For those of you who were on the NCF E-lab this morning, we had a really good example of somebody who had found challenges with logging CPD and had now certain tools that enabled them to do that. If you do register with FedIP, then there are some really useful tools there as well around logging your CPD, which is a core part of professional registration. So it makes any future registration much easier because you've got all your learning sat in one place. There's lots of forums within that FedIP hub as well, so you can network with either other analysts or data professionals, as well as other members from those other member organisations. And there's some really good CPD learning on there, including free courses from Edinburgh University, lots of webinars, and the member organisations within FedIP will often do webinars within their own areas, which allows people to sort of broaden their horizons in terms of what's happening within those other spaces. And there's also a monthly newsletter which comes out, which is really useful and signposts you to all of kind of the latest activities within FedIP. So in terms of the journey of professional registration so far, so professional registration started with the creation of FedIP about 8 years ago, and the member organisations have kind of come on board during that period. So AFA became part of the FedIP family in 2017, and since then we've been building and refining our registration standards, and we now have, I think at the end of June, it was almost 60 analysts and data professionals on that FedIP register. The overall FedIP register has about 560 registrants on there, so it would be really good to see more of the analytics and data professions taking up that registration. So before we go on to the process itself for registration, so why is it important? So it does provide that assurance of your skills. So it is a independent review of your skills and competencies and how you put those into practice. It gives you that level of credibility, because it is independent and peer reviewed. There's an element of standardization in this for me as well. So if you look across, you know, only within the NHS, there is such a broad range of ways that we can describe people working in our analytics and data professions. You know, there's a handful of those on the screens when I did a last look through NHS jobs or anything with the word sort of data or analyst in. But your professional registration, whether that be at a practitioner level or an advanced practitioner, it gives that standardization that we know that if you are registered as a practitioner, there is a level of competence that you have. So that can be really useful in terms of moving through either within the NHS or across other organisations within health and care. It kind of gives you that sort of baseline of where you are. And ultimately, it's about patient safety. So we've got the quote there from Amanda Pritchard saying, you know, a good analyst can save more lives than a good anaesthetist. You know, we hear that, you know, good data and analysis can save lives. So obviously the converse of that is that if we have analysts and data professionals who are practicing in an unsafe manner, then that can have, you know, quite severe consequences if the outputs from those individuals are then used in terms of any sort of decision-making process. So it's a really important thing to have, and as Jane said, our counterparts in either the clinical professions or in the finance areas all have a requirement to be, you know, professionally registered, and we need to move that forward within analytics and within our other data professions. So for those of you who were on the National Competency Framework session this morning or have seen some of the outputs of that NCF, I think it's important to say that professional registration is quite a different thing from the NCF. And the way that I like to look at it is that the National Competency Framework, it lets you know what skills and competencies you need to be successful within your role. So it provides the tools within your own skills and competencies for your roles. What professional registration does is says that you are safe to practice with those skills. So you have the tools and you know how to use them safely. And that, I think, is the important sort of differential for me between the competency framework and the professional registration process. We are working through the professional registration standards at the moment, so we could highlight which standards relate to which competencies within the National Competency Framework, so you can do that ease of read across between the two, but they are two subtly different things. Okay, so how do you become professionally registered? So it's about, as I've said, being able to demonstrate that you can use your skills and competencies in an appropriate way. You can undertake reflective practice, so part of being a professional is being able to take a step back from any work that you have done. Didn't go quite as well. What would I change? What have I learned from this? So that reflective practice piece is a really important part of the process. There's an element of CPD. So yes, you've got skills and competencies now, but how do you ensure that you keep those up to date as you move forward into the future? And then, like any other professional organisation, there's obviously a requirement to abide by a professional code of conduct, and at AFA we have an AFA professional code of conduct which you're expected to abide by. So the process for registration itself, and so just a recap that it's AFA who oversee the registration process for the analytics and data professions, but it is FedIP who award that. There are 3 elements in terms of the process for professional registration. So there's an application form for completion, and there's the reflective practice, which is the really important part. So we look for 3 pieces of reflective practice that supports your application. So they can be 3 projects you've worked on, 3 large pieces of work. And then finally, there's the evidence. So essentially being able to provide the evidence that that shows that what you're talking about within your reflective practice was your work. And all the application process for professional registration now is run through the FedIP hub. So you will register through the AFA website onto the FedIP hub, and then you will take forward your application from there. So I'm going to hand back to Jane just to talk a bit more about the AFA support that's within that and the various levels of registration.
Okay, thank you. So we run a cycle, a quarterly cycle for the registration, simply because those of us that are on the professional development committee that do the applications and the assessments, it just gives us windows when we know, we will receive applications, so we can put time by to go through and assess. And it also helps us provide support in a more timely manner to your submission. So if you're looking to submit in October, at the beginning of October, we will hold a workshop, a webinar on an overview of the application process. So what Emma has just described about the application form, the reflective practice and the evidence, we will go into a lot more depth during those webinars, giving examples and actually working through some examples of what we can expect in these applications and how to pull it together, how to use the form, the matrices and everything that we provide to help you keep that together. And then later in the month, towards the end of the month, we'll hold another one. So those of you that have gone through and done your application through October, it just gives you a chance to pop onto a webinar at the end of the month before you hit the submit button to ask any questions that you might have had with regard to the application that you are about to submit. Now you can pop on to AFA and register with FedIP anytime you want. You can do it today, but the application process, the webinars they happen within the month of that submission, but you might take your time doing it. Although from experience, I would suggest that if you are doing an application, don't take too long, don't spread it out for too long, because you lose your train of thought and you get to a question, you think, oh, did I cover that one? Try and keep it together. Try and do your application over 1 or 2 days. If you take the time out, it can be done in quite a short period. It seems ominous, but actually if you concentrate and put that time by, you can get it done in a couple of days. So once you submit it, we then process the applications. We may come back to applicants to have we might have some questions. We are there to try and get you your registration. We're not there to try and block people from coming through. We want as many people registered as possible. However, we are using this as an assurance to employers, future employers, and to yourselves that you have the abilities to practice at a standard. So if we think there's a piece of evidence missing, we might just phone you up and say, we could have really done, have you got the minutes to that meeting that say that you presented on this, that and the other? That's, just send that to us. There might be things you can't send us because of IG. So we'll say, okay, well, let's just have a call, and we'll have a one-to-one call with you and, you know, discuss through things. So if we do come back to you and say, can we have a bit more, or can we have a chat? Don't panic. It's just because we just need a little bit more assurance from ourselves. And we use that period to go through that before we get back to the applicants. And then it goes through a professional development committee, and we have to ratify. It's not just one person's decision. We take that back to the committee and say, these are my recommendations, and, you know, we sign it off as a group. And there are guidance documents available on the website. So selecting your level of registration, as I say, there are 5 levels of registration. As Emma suggested, this is another piece of the jigsaw. It fits in with the National Competency Framework. The National Competency Framework is looking at what competencies do you need for a particular grade. The registration is about what you can do, what you have capability of doing, your ability to use those tools. It's not tied to your grade. Or what your job description is. It's about you and what your ability is. So when you're looking at the levels of registration, and there are documents on there that show them side by side, so you can pick which one you want to go for. You can apply at any level. You don't have to start at the bottom and work up. If you're a you know, senior practitioner already, go straight in at senior practitioner. But you have to be sure that you can answer every single requirement at that level. There's no good if you've got 95% at one level, you know, at a level, but 5% are still at the lower level. Either wait or submit at the lower level, and then next time round submit for the higher level. But you have to be able to pass the level for every single question. But again, the resources on the website will help identify you for that. So the levels we have, the first level is associate practitioner. This is a entry-level registration. So people that are new to analytics, people that are new into health and care. It's the quickest, easiest one. All the others require all the reflective practices and the evidence. With the associate practitioner, all we're asking for is, correct me if I'm wrong, Emma, 250 words, is it? Yeah, so 250 words. We just want you to write, this is what I do, this is where I am, this is what I'm aiming for. And I pledge within the next 2 years that I will apply to be a registered, a fully registered practitioner at whatever level you apply for at that time, that you commit over those 2 years to continuing to professionally develop yourself and do what you need to do to get to that level. You don't have to wait the 2 years. You know, if you're ready to go for it after 6 months, a year, go for it. But you're just making a pledge to do that after 2 years, within the 2 years. So the practitioner level, which is the earliest one, the lowest one, for people new into the job, maybe don't have, you might not be supervising teams, you know, you might not have full autonomy. There might be more routine work than working on complex stuff. But you know, you have an ability, obviously, to choose the tools you need to use. So that's the lower practitioner level. Then we go up to the senior practitioner. So you might have more autonomy within your role. You might have responsibility for work of others, not necessarily managerial. You don't necessarily have to be, you know, managing a team, but certainly aiding others within the team, checking their work or helping them out, maybe, you know, sharing a bit of training, but just a little bit more responsibility there and helping others through. and a different range of work, starting to work some of the more complex stuff rather than just the reporting, routine reporting, and looking at how you can use tools to undertake the different work and how you can improve things in that regard. Then we go on to the advanced practitioner. So much broader range of autonomy here, working relationships to a much wider range of colleagues within other areas, more complex data analysis and analytical tasks, providing advice to others on standards and methodologies. So you've got quite a lot more responsibility here, and appraising the tools and techniques that may be most appropriate to various things, not just for yourself, but maybe for teams as well, and making recommendations on that. The leading practitioner, we're sort of moving up the scale here. Authority over a significant area of work. You know, you're probably leading teams. Well, you will be. Your role might be a lot more strategic. You'll find that sometimes within the profession, if I went back and looked at the registered practitioner level, I might struggle because I don't have some of the much more recent experience of doing some of the analytics, because I might be working on strategy. I might be working on strategies on how to do things. I might be working on operating procedures, target operating models, and not necessarily doing it. So things like the leading practitioner, you'll find, will ask about because obviously we're all analysts at the end of the day, but my team of analysts might have much more technical knowledge than me. So, you know, don't be put off and think, oh, well, I can't do Python, but someone in my team can I be doing leading practitioner? But if you're leading the teams, as long as you have understanding of these things and when it's necessary and what's needed and how to apply things and what needs to be, you have to have that basic, you know, the overall understanding of how analytics is moving forward as well, with AI and everything else and what's needed. But your role itself might be more strategic, as I say, more operational. So the leading practitioner role might be more focused on that than the nitty-gritty analytical technical stuff. So the leading practitioner is the highest level that we go to out of the 5. So I'll hand back to Emma now.
Thanks, Jane. So when you've decided which level that you want to apply for, over the course of the next few slides, I'll walk you through kind of the nitty-gritty of how you complete that application form. So as I said earlier, you register to start completing your application through the FedIP Hub. So you will find the link through the AFA website under our professional registration section. There will be a button on there to apply, which will take you through to a registration process to the FedIP Hub, and then you will receive your logins from there. So when you get onto the hub, you need to select the level that you've chosen to register at. You will then be able to download both the registration form, and we also have some templates for reflective practice. So we use the STAR technique of reflective practice, which is situation, tasks, actions, and results. There are some templates there which you are more than welcome to use and fill in. The majority of our applicants will use that. We're not restricted to those templates, so if you wish to put your reflective practice into another format, that's fine, as long as it follows that STAR outline and process, and it picks up the other questions around the reflection after you've completed a specific piece of work. So your next step, what I would recommend is, rather than starting with the application form, start with your reflective practice. So think of 3 either projects you've been involved with from a data and analytics perspective, or some chunky pieces of work which will enable you to show competence across as many standards as you can. And then as you're completing your reflective practice, you need to be flagging within that reflective practice template which standards you're achieving as part of that work. So a quick overview of the standards themselves. You'll see they cover a really broad range of skills and competencies, from the methods that you'll use as part of your role, through to how you organise and plan your work, communication, CPD in terms of your continued education and learning is in there. But essentially what you're doing through the application process is outlining what the journey is of a particular piece of work. So that very squiggly road, but you can tell I'm an analyst and not an artist by the rather lumpy squiggles there. But you know, you'll choose a method in order to solve a certain problem, or you deal with a certain task. So talk to us about what you've done there, write that within your reflective practice, how you've organised and planned that particular piece of work. Have you used your own initiative as part of that work? Was it an autonomous piece of work that you've led on, or have you involved other people within that? Which elements of the work were you responsible for? Were you also, you know, responsible and accountable for the outputs right across the board? Did you get involved with checking other people's work as part of that? Did you work with other teams? How did you then go on to talk about the work and communicate the outputs of any analytics or data tasks? And then ultimately, what was the learning from that? So what was the CPD element? So that's what we're trying to draw out. So you can think of a piece of work or a project that you've done and start thinking about, okay, how did I solve the problem? Who did I communicate with? What were the methods that I use? And start to tell that story of your piece of work, referring back to those standards. So I've got an example piece of reflective practice here. I'm just going to nip over to my other larger screen on my left, because what I can see on my screen is minuscule. So this is an example of the reflective practice. So you'll see that STAR methodology there. So what was the situation? What were the tasks that needed to be completed? What actions were taken? What were the results? So this particular piece of reflective practice is around some analysis on length of stay. And you will see within the square blue, the square blue elements on the screen, they refer to those standards which we've just looked at. So if we pick out one of the elements within the situation piece, so it says my line manager asked me to undertake some analysis around length of stay, and I worked on this on my own in order to complete that. So you're highlighting there something about the methods that you've chosen. So they're your first set of standards, those P1 standards. You're flagging that you worked autonomously on that. So they're those P4 standards around autonomous practice. And you'll see littered through that STAR methodology, the reference to those standards. So I decided the best way to analyse my data was using SPC. So that's about how you choose to solve the problem, so those P2 standards. And then you'll also see in the tasks that this particular individual, so that final element of the task was about improving their knowledge in SPC. So they've undertaken some training. So that ticks the P9 standard, which is around your continuous professional training. And so you can see how starting to articulate a piece of work leads you to start looking at those standards and going, yes, this references this standard and this references that standard. So the other side of the reflective practice is that piece of reflection. So how it went, what went well, what went less well, what you choose maybe to change next time, what you learnt. So they're a really useful way of easily taking a single piece of work and then being able to reference as many standards as you're able during that. You'll see it's quite concise. It doesn't need to be War and Peace, but the important thing is the referencing of those standards. So from an assessor's perspective, it's easy for us to go, yes, I shared the SPC charts in a short presentation. Yes, that's P6. That's about how we talk about results and that sort of communication element. So when you've done your reflective practice, then it's important to show that you have evidence that kind of backs up that piece of work. Use the matrix within the application form. So you'll see an example of the matrix there. So it lists all of the standards on the left-hand side, and then you will just reference which piece of evidence you're submitting refers to that standard. Most people choose to number their evidence just to make it easier for the assessor to navigate. You do need to have evidence for each standard, but you can use the same piece of evidence for multiple standards. So thinking back to the example reflective practice we've just walked through, example evidence could be a copy of the SQL script that was used in order to extract information, a copy of the presentation that was done, as Jane mentioned earlier, minutes, or an agenda which showed that you went and presented your information. It could be something as straightforward as an email, again, which just shows your involvement within a particular project or piece of work. A lot of people send in for their CPD an outcome from a particular training program. So lots of various pieces of evidence that you can use. So what happens if you've done your reflective practice and there's still some standards which you haven't evidenced? There's an opportunity within the application form to enable you to say, okay, so I haven't necessarily referenced the standards around, let's say, collaborative working within my application. So there's an opportunity for you to draw out some short narrative which gives an example of when you've met those standards. There's some hints within the application form itself about the sort of things that you might be wanting to write about. But again, once you've done that, we just need a little bit of evidence that supports that narrative as well. Finally, because this is registration for practitioners within health and social care. There's a mandatory set of standards from FedIP, which just talk about the context that we work within the health and care sector. Again, it's just 2 short summaries which show that you understand about the environment that you work in, some specifics around IG, etc. But they are just some short summaries, so 200, 250 words. Again, you know, we don't need reams and reams of information, but just that overview that shows that you understand where your role sits within health and care and that impact ultimately on the patient. So final step, you'll sign off your application. You'll get somebody to sponsor your application. It's normally a line manager, but you know it can be another peer or independent person. If your sponsor is already professionally registered, they can also sign off your evidence. So that means that the assessor will just look at your reflective practice and will not assess the evidence that you've submitted, because that's already been signed off by a registered professional. And then your final steps are just to upload your application form, your reflective practice and your evidence onto the FedIP hub. And it's as simple and straightforward as that. We get some common questions which come out, which are probably just worth drawing out here before we've got some time to take some questions from you. So we always have a question about, well, what if my evidence is confidential? And what we do is say, well, note that within your application, and then as Jane mentioned earlier, we'll have a call with you and you can talk us through a specific project without breaching any sensitivities or confidentiality. In terms of the extra information that you might want to drop into your application form, people are generally ask, you know, how long does that need to be? 250 words. So the majority of your standards should be referenced through your reflective practice. So it is just short examples within the application form itself. Do I need to provide evidence for every standard? Yes, please. We do need to understand that what you're submitting is evidenced. But as I said earlier, you can use a single piece of evidence to reference multiple standards. And then finally, the numbers of reflective practice, it's a minimum of 3. 3 pieces of reflective practice, you know, generally allows people to tick off the vast majority of those standards. If you want to do more in order to make sure that you've referenced all the standards, that's absolutely fine, but it is a minimum of 3. So I'm going to stop talking there. I'm happy to pick up any questions or questions within the chat. I'll stop sharing my screen.
Yes. Thank you very much for that, Jane and Emma. I can't see any questions in the chat, which simply means you did an excellent job of explaining the process. And you did a great job of saying why it's important to be registered and to help people see how actually simple it can be, and I think probably a bit quicker than people may have thought. Just a little bit of focus over a couple of days, a little bit of hard work for a couple of days, and I think great things could be achieved just within a short period of time. So if you're impatient like me, then that might be the kind of thing that you do, as opposed to sort of allocating a little bit of time over a period of time. So a question has come in the chat. So who should we contact regarding the application while we are registering?
So I think if I understand the question correctly, so everything is done initially through the AFA website and then onto the FedIP Hub. If you have
Okay.
questions about the application whilst you're completing that application process, you can either email AFA, so there's an info@AFA email, or you can join, as Jane said, some of the webinars that we have. So we do 2 in each application month. One provides that overview, quite similar to what we've already walked through here, and then just before kind of the end of the month, usually a week to 10 days, we'll run a surgery, which is particularly for if anybody's got any questions that they have. So if you've completed, you know, 80% and you're just a bit stuck on one of the standards and what you might need, then we can run through some of that there. It's kind of far more sort of tailored, that end session. And then once your application is completed, it will be allocated to an assessor. And if that assessor then needs to contact you, then that comes straight from the assessor itself. So I hope that's answered some of those questions.
Okay, I think it has, and I was doing a great job of keeping on top of questions because there was just 1 or 2. Now there's about 10, so I'm just I'm going to have the next one that came onto the chat was this person, Jessica. I apologise if she missed this, but do you automatically AFA membership?
So no, it isn't included in the AFA membership. This is on top of your AFA membership because the registration is with FedIP. So there's a further £25 a year, which is paid to FedIP via AFA. And then that opens up all those FedIP offers as well that I mentioned at the start of the application, of the presentation. I've got applications on the board.
Okay, next question, is AFA for NHS only, or is it more widely recognised?
No, it isn't. It isn't just for NHS. It's for any analytics or data professional working across the health or care spectrum. So if you look at the other member organisations within FedIP, they aren't just NHS organisations. So the Chartered Institute of Library Professionals will have library professionals who are right across the spectrum, whether that's in healthcare or industry or within public libraries. So AFA is exactly the same. So it's for within health and care, but it isn't just NHS specific.
Yeah, we do have members actually from private, you know, commercial organisations that deal with data and analytics and health. We have people from public health, social care. So, you know, there's a wide spectrum. It's not just NHS.
Okay, thank you. The next question, I think I probably know the answer. So does all the reflective practice submitted need to show work done within healthcare, or can you use examples from work outside healthcare?
So I guess from a pragmatic point of view, if you're an experienced analyst or an experienced data professional, and you're only recently within health and care, then we would look at examples from sort of previous experience. But we do need to have at least one piece of reflective practice, which is that sort of health and care example. And then obviously those contextual standards, which you need to write your summary around at the end, then kind of provides that summary that you understand the environment you work within health and care.
Okay, thank you. The next post has a couple of questions in one. So I'll just read through them, and then you can give me some swift responses, and then I shall store the other ones up and I'll send them to you after the session today. The first question that they say is, can recognition emails or similar from colleagues be used as evidence? For example, thank you, that was a great piece of work. Rachel, what do you think you were doing? You know, that kind of thing.
Yeah, no, absolutely. And we see lots
Okay.
of that within evidence, you know, particularly around how your work's made an impact and you receive that feedback.
Yeah. And isn't it nice to get great feedback as well?
Absolutely.
means a lot. Next point was, how much is organisational registration, or does it depend on the size of the organisation and the number of colleagues?
So registration is individual. So your organisation may choose to fund your registration with FedIP, but it's on an individual basis. The AFA membership is a corporate membership. So and obviously if you have a number of people within a team that wish to pursue AFA membership, then we can do that at a corporate level, but professional registration is individual.
Okay, and then their final point was how do you move to the next level? Is it just a case of submitting new evidence once you've collated it?
Yeah, so what I didn't mention in the presentation is that your registration lasts for 3 years. If at the end of that 3-year period you choose to move up to a new level, then that is a new application form with all your reflected practice and evidence at that higher level. You don't have to wait 3 years, as Jane said. So normally we'd expect people to be registered about 12 months, before looking at moving up to the next level. If at the end of the 3 years you are retaining the level of registration that you're registered at, so if you're an advanced practitioner and you're still an advanced practitioner level at the end of that 3-year period, there's a process of reaccreditation, which is slightly lighter touch than a full application. So it's a bit of reflective practice and evidence of the CPD that you've done in the preceding 3 years. So it isn't a full application process in order to maintain your current level of registration.
Thanks very much. We're approaching the end of our time slot today, so I'm going to do what I said about the questions. You're not getting away with it. Oh no, I will collate them beautifully, and if you could respond to them, then I can get the responses back to our lovely audience after today's session. So I would like to thank you very much for spending time with us today. I think it's been a really, really helpful session, as I say, to tell us about the importance of professionalisation and how to do it, because that's kind of important as well. I would also like to, while I have you in the room, undivided attention, I would like to tell you about the next E-labs, which are about to happen tomorrow and the next day. So the first is guiding leaders to better quality decisions, the pivotal role of analysts, and we all know how pivotal the role of analysts is, but we should be talking about it more, and I think this is going to be an excellent session tomorrow, and that's with Sam Riley, who's the Director of Making Data Count, and Andrew Bourne, who's a BI and Data Science Manager at Morecambe Bay NHS Foundation Trust. That's tomorrow, that's at 2 o'clock, and it's very popular, and I do think it's something that I would think you would get a lot out of that as well. So that's tomorrow, and then on Wednesday we have 2 more, and these are the final 2 E-labs, so they are clearly not to be missed. So the first is the anatomy of a waiting list, understanding our waiting list, and that we've had a similar version of this in a Midlands Analyst Network huddle, and it makes Professor Neil Walton makes it very accessible and understandable, and it makes you truly believe you can do something about waiting lists by using the methods that they talk about. And then we have using system dynamics in local authority public health practice. Again, please do come and see that. That's with Abraham George and Peter Lacey and others who are going to be talking about how they've used system dynamics models to improve health inequalities. So on that, I'm just going to check the time. I'm just 1 minute over. I think that's fine. What's the confidence limit around that? And I think we're good to go. So thanks again, Emma and Jane, and thank you everybody for coming. I hope you register for the remaining E-labs, and I hope to see as many of you as possible at the HACA conference on the 23rd of July in Telford. Okay, bye bye then. Thank you.